What I'm going to do if I don't have that manometer is I'm simply going to set my device to its lowest threshold. And I'm going to have the patient, I'm showing an expiratory training setting. And I'm going to have the patient take a big breath in. You'll hear the whoosh of air through the device, and that would be the person doing the task at the lowest setting. I'll then just do a quarter turn. There's not a science to this, per the instructions on Aspire's website. Quarter turn, do my next trial. And I'll keep doing that. Keep quarter turning. Do it again. Quarter turn. And it's going to get harder. Each time I'm doing this, my weight in my weight machine is getting harder for me to lift. I can feel it. And there's going to be a point where I can hardly move air through the device. Now for me, that's falling right at the mark of 80 on the RMST device. I don't want to train at that point because that's too much effort. It's too strenuous. It's going to probably make me feel lightheaded. I'm at basically my low tech strategy of defining what my MEP is. So what am I going to do? I'm going to multiply that 80 by 0.75, and I'm going to start somewhere around the 60 centimeter threshold area for my treatment protocol. Because I always want to be 75% below my MEP, and my MEP in the low tech strategy is where I can barely get a squeak of air through the device, right? So that's how you kind of go through and set the device with a low tech strategy. Set it at the easiest. Big breath in. Quarter turn. Re-instruct your patient. Big breath in and blow. And continue to work your way until you get to a point where the patient can only squeak some air through. Record the number down. Multiply it by 0.75. Back the device up to that setting and start training week 1. Training week 1 will consist of 5 breaths through the device 5 times. So for a total of 25 breaths through the device in one session. And I typically will have the patient do the 5 breaths, pause for about a minute, have them take a rest, and then redo the 5 breaths. Now the 5 breaths are not a race. 5 breaths, breath 1, breath 2, big breath in, blow as hard as you can. Notice I'm holding the cheeks so the device is not popping out of my mouth. Big breath in, breath 3. The device is not in front of the teeth, the device is behind the teeth. Nice lip seal around the device. Breath 4. And breath 5. Now, obviously, I'm a healthy woman. I don't have a problem with the lip seal. I don't have moisture in my mouth. Those are all things we accommodate with. It will take me half the time to do the training that it would be a patient with Parkinson's disease. But we found out from Michelle Troche's paper that in a telehealth study, that the average time it took to train patients with Parkinson's disease with RMST using a telehealth interaction was 17 minutes and 60 seconds. So it is not a long protocol to run with your patients. If we're training with RMST, we're doing the exact same thing, but we're putting our device into the IMST adapter. And we're going to do the same way, except we're going to blow all of our air out. Actually, let me set it. I'll just show you one trial. Blow all the air out. And breathe in. The IMST adapter will actually make a little sound. It's a little bit more audible than it is on the EMST side. But remember, you know you're breaking through the pressure threshold valve when you hear the whoosh. Right? And on the IMST, there's a little bit more of an acoustic sound when you break open the pressure threshold. You don't hear those sounds, you have not broken the pressure threshold, pressure relief valve.